Hi everybody and welcome back to my little YouTube channel. If you're new to this channel, my name's Amanda. I'm a diagnosed autistic adult. I was diagnosed a few years ago. I'm making these videos in order to help other autistic people to get the support that they might need. It can be really difficult to get autism support in adulthood in the United Kingdom. It's there for children, but it just doesn't seem to be there for adults. So that is why I'm here. So if you're interested in learning more about autism, this video is for you. So firstly, let's talk about what autism is. Autism is a neurodevelopmental condition. It's a genetic condition. We're born with it and we have it our entire existence. You've probably heard it's a spectrum, so we're all different just like anybody else on planet Earth, and we all have our unique characteristics. It's not something that you can take a tablet for, it's not something that can be cured. We have it our entire existence and it can affect all our lives. So things like sensory overload, bright lights, loud noises, foods, tastes, textures. We can get obsessive compulsive disorder, we can get anxiety. Anxiety is something that affects a lot of autistic people. It affects me badly, anxiety does. So it really does encompass our entire existence. In today's video I'm going to talk about what happens during the autism assessment. There's not many videos about that on YouTube. I've been looking. I've seen videos about children, but I've not really seen videos about what happens during an autism assessment for adults. So that's what we're going to talk about today. So if you're waiting for your autism assessment, and it can be an incredibly long wait, over 3 years in the UK I waited, then you might be interested to hear what happened during my assessment. So let's begin by talking about what would make you want to go for an autism assessment. So that's quite obvious. If you're watching this video or you're thinking about going for an autism assessment, you obviously think that you are autistic, and check out some of my other videos about some of the signs and symptoms of autism. There's plenty on my channel. But usually if somebody thinks they're autistic, the first thing to do would be to go and see your GP. That's what I did. I watched a documentary on BBC News, this lady that had autism, and I thought I recognise a lot of those symptoms in myself, so I went to my GP. But the first thing you can do is you can do what's known as an autism quotient questionnaire, and I'll talk to you about that now. So there are a few things that you can do yourself before you go to see a GP, and the first one is you can do what's known as an autism quotient questionnaire. And if you type into Google, I think I might be autistic, or autism assessment, and it should be free, make sure you go for a free one. It should bring up what's known as a quotient questionnaire, or this autism assessment. It's usually about 20 to 25 questions, and it asks you things about how you struggled in your childhood, whether you prefer to spend time on your own in comparison to being around other people, and it asks you all things related to your personality. And at the end of it, it should be free. It shouldn't ask you to pay. So if it asks you to pay at the end of it, go on to one that's free. I went on to, there's plenty that's free, don't pay for one. At the end, it will tell you whether you scored highly for autism or whether you didn't score highly for autism. It's always worthwhile filling that in first, so that you can take that to your doctor or your healthcare provider, and then you can present them with that information, and then they can look at that and get the ball rolling with regards to whether they think that you do or potentially do qualify for further autism examination. Now, you might feel a bit frustrated because there isn't much that your GP can do in that instance when you go for an appointment in terms of diagnosing your autism, because a GP can't diagnose autism the same as a nurse can't. It needs a specialist neurodevelopmental centre, or it needs a psychologist or a psychiatrist. So the GP will take the information that you've given them and they will then make a referral onto a neurodevelopmental centre. So you might be wondering, once you've done that, you've done your autism quotient questionnaire, you've been to your GP, you've presented them with the information, and the GP's agreed and referred you on to a psychologist, psychiatrist, CAMS, neurodevelopmental centre, wherever it might be. And you might be thinking now, well, where do I go now? Now I've done all that. What support do I get? Because there's a long waiting list. Like I say, I waited for over 3 years for my autism assessment and diagnosis. And there are things that you can do. It can feel really frustrating because it feels like we're just stuck in limbo for years, and that's a lot of the time where people hit crisis, because we've had autism all our lives and we suddenly hit crisis point because we feel different and we're not getting the support that we need. It seems to be there for children, but it's not there for adults. And the things that you can do are look at YouTube videos, and you can look at places like the NHS websites to get support and guidance and help. And there are other things that you can do as well, like talking to your healthcare provider or your GP, and they can look at whether you have existing medical conditions such as anxiety, and they can then put you through to sort of talking therapies. If it suits you, it doesn't suit me, it doesn't suit everybody, and certain medications that they can think about putting you on. But you must talk to your GP or your healthcare provider first. But just, you know what, opening up to friends and family, talking to other people on YouTube is the first step to obtaining support and looking after yourself better. Other things that I did as well is I joined Facebook and I went on autism support sites, and there are so many different support sites for autism, and not only autism, for anxiety and depression. And I always have felt so alone all my life, and then I suddenly joined those sites on Facebook, and there were so many other people saying that they felt anxious, that they felt misunderstood, that they felt alone, that they didn't feel supported, that they felt depressed. And suddenly I didn't feel on my own anymore. So it might be worthwhile just checking out some autism support sites on Facebook as well, because they've been just invaluable to my mental health. So now we've talked about what you do when you go for an autism assessment. So you think you're autistic, you fill in the autism quotient questionnaire online for free, you go to your doctor, you present the information, the doctor refers you to the neurodevelopmental centre, CAMS, the psychologist, psychiatrist, you're waiting for an assessment, you're accessing YouTube, you're accessing Facebook, you talk to family and friends about obtaining autism support while you're waiting. And now let's talk about the most important thing, which is what happens during your autism assessment. So after the doctors referred you to the autism assessment or to the neurodevelopmental centre, which is where I went to Sheffield, to a place called a neurodevelopmental centre, to an autism centre, and it was a psychologist that assessed me. Before you go for your appointment, they'll actually send you a questionnaire similar to the autism quotient questionnaire, or the questionnaire that I've just discussed about earlier, and hopefully that you've looked at now. I'll leave a link in the description or the comments below to one that I used, a free one, a good one. It's not an official, when you complete that, please know that it's not an official diagnosis. You have to go to an actual psychologist to be officially diagnosed with autism. But they will actually send you a document, a questionnaire document, and it's like a pre-screening questionnaire, and it asks you all sorts of different questions, and it's always a good idea to get your family or your friends or a guardian or a relative, somebody that's known you from childhood, to sit with you and fill that in with you, because they know you more than you know yourself. They've seen things in you from your childhood that probably you can't remember. And it will ask you things like, when you was a child, did you used to interact with other children, or did you prefer to spend time on your own in solitude? If your parents or your guardian or whoever looked after you, if they initiated play, so if they brought Barbie to you, for example, or a train to you, did you interact with them, and did you take Barbie off them, and did you play, and was it a two-way thing, or did you just ignore them? If your parent or guardian spoke to you, would you talk back to them, or did you just ignore them, or seemingly it felt like you was being ignored? It asks you things about your childhood development in school, how you went on in school, how you worked alongside, how you played and studied alongside other children, for example. And so it asks you all sorts of these things, which is why it's really important to take a parent or a guardian with you, because they can be an invaluable source of information with relation to your childhood development. And then it asks you then about growing up. How did you cope as an adolescent? What relationships did you have? Have you always preferred to be on your own? Have you had any social or communication problems? Have you had any sensory problems, processing problems? It asks you all of these questions, and then once you've filled in that questionnaire, you send it back to them, and it's almost like a good pre-screening tool, because if they then think that you could be autistic, they'll then get the ball rolling and send you for a face-to-face appointment. Now let's just bear in mind that the information I'm giving you now is based on an adult autism assessment. It's not based on an autism assessment for children, and so you'll need to access different information for that. And this isn't like the be-all and end-all of what happens during an autism assessment in the UK. This is based on my experience, and so everybody's experience and everybody's assessment process and everything is going to be different. So this is just to give you just some general advice. So if you're looking for advice with regards to an autism assessment outside the UK, that's going to be for somebody else's video, and likewise for children, again, that's going to be somebody else's video, and you might experience different questions from the assessor, so it's don't take my whole video for granted, because it might be different for you. The assessor at your appointment, when you go for your neurodevelopmental appointment, they'll also be interested in your co-occurring medical conditions such as anxiety and depression. A lot of the time, autistic people, we can be diagnosed with anxiety disorders, for example, or depression disorders, or even sometimes almost like split personality disorders before we've been diagnosed as autistic. So this information can be invaluable to the assessor. So make sure that you take with you your prescription and a detailed history of your past medical conditions. Coming back to what I've just previously said, you might be wondering if you can take somebody in with you to the appointment, and if you feel comfortable in doing so, then yes, you absolutely can. And like I've just said previously, it's usually invaluable to take somebody with you, a parent or guardian or a friend or family member, somebody that's known you from childhood, because they can be such a useful source of information with regards to your childhood development. You might be wondering whether the assessor will actually tell you if you do have autism or suspected autism on the day, and I can only advise with regards to my personal experience, and that was yes. The assessor asked me whether I wanted to know there and then whether I had autism, or whether I wanted it as a paper copy, whether I wanted a letter. And of course, if you're anything like me, you've waited 3 years plus and all our lives to know why we feel different to everybody else. So I wanted to know straight away, did I have autism? And she told me yes, I did. But I just want to clarify a little bit about what I've just said, because it might be that once you've been through that whole process, and even if you waited, that you don't have autism, and we'll go into that a bit more now. So what do I mean when I say you've gone through that whole assessment and then it might not be autism, you might not have autism? Well, the assessor will tell you before the appointment begins that once they've asked you all the questions, it might be that you're autistic, it might be something else. And that's because autism can look like a wide range of different medical problems, in particular mental health problems, and it can look like almost like borderline personality disorders. A lot of autistic people can be misdiagnosed with borderline personality disorders and anxieties and depressions, but likewise a lot of people with borderline personality disorders may be misdiagnosed or may have autism spectrum conditions. And also antisocial personality disorders, which you probably know, put my teeth back in, as sociopathy, which is a really tricky one to talk about because it can get keyboard warriors in the comments. But I have to tell you that a lot of autism signs and symptoms can look like antisocial personality disorder or sociopathy. And so while a lot of autistic people can be misdiagnosed with autism and it could be antisocial personality disorder, the same goes for people that might be diagnosed with antisocial personality disorder. It's actually autism. And so you can understand what I'm saying. A lot of these medical problems, these medical conditions, these mental health problems can be misdiagnosed because it can be really difficult, especially when, for example, you get somebody like me that's really good at acting, and I've learned to act and I've learned to people please, to know whether that could be sociopathy or that could indeed be autism. And although it's a bit of a tricky subject to talk about, and I'm dead careful in what I say, it often makes me wonder how many people with autism actually have antisocial personality disorder, and vice versa, how many people with antisocial personality have autism. And so it might be that at the end of the assessment, the assessor tells you that it's not autism, it's one of these completely unrelated conditions. So if you prefer not to be told there and then at your appointment that you have autism, they can send you a paper copy, and indeed they'll send you that anyway. So even if they tell you there and then on the day, they'll send you a letter detailing your assessment, and they'll detail things like your strengths, things that you're good at, things that you struggle at, and then you can use that for example, an employment setting, and you can present it to your employer, and they can then, or they should do, put something called reasonable adjustments in place in order to help you function just as well in your workforce as in comparison to your colleagues, for example. And also then it will go down on your record. So what are some of the benefits of going for an autism assessment? Because you might be watching this video thinking, is it worth waiting 3 years and going through all of that to just be diagnosed with autism? So let's just discuss that a little bit more. So what are some of the benefits of actually going for an autism assessment and getting officially diagnosed? Well, the first one is that if you are officially diagnosed with autism, you're covered under something called the Equality Act 2010. That's in the United Kingdom. And so if you go for an employment opportunity, if you get a job, you go for an interview, the interview process, even the education process, the workforce has to put in something called reasonable adjustments. And that is something, they're usually free and cost effective, so they don't sort of cost the workforce anything. So it's nothing like thousands and thousands of pounds to implement something to help you work better, work more effectively in your job, if that makes sense. But it's there to help you function at your best in education or the work environment. And so the beauty of having an official autism diagnosis is you are protected with regards to disability discrimination that comes under the Equality Act 2010. If you don't have autism, if you don't have an autism diagnosis, I should say, then you're not entitled to the protection under the Equality Act. And there are exceptions to that, so don't hold me to that. In law, there are legal exceptions to that. So if you're waiting for an autism assessment, if you've been provisionally assessed as being autistic, if your doctor suspects that you're autistic and it's on your record, there are legal exceptions to that, so don't hold me to that. But the beauty of it is having that official diagnosis, it gives you clarification with regards to why you feel like you've struggled so long for so many years of your life, and you don't feel like you're on your own anymore because there are other autistic people that feel exactly the same. And also you're covered legally in terms of employment and discrimination and victimisation. So I hope this video has helped you to better understand what goes on during the autism assessment process, and I hope it's put your mind at rest a little bit. If it has and it's helped you, please consider hitting like, commenting and subscribing, and don't forget to share this video on your social media, on your Facebook, so that other people can see the video and hopefully it'll help other people along their journey.